Hi friends, Dr. Sunshine here, and today I would like to talk to you about two very common emotions, especially for those of us struggling with addictions, eating disorders, traumatic experiences, and any other compulsive behaviors. So I'm gonna be talking about guilt and shame and the important difference between the two of them. So even though often people use them interchangeably and kind of, yeah, a lot of people think both are the same thing, there is a fundamental difference between them that actually has very big consequences for your recovery and for your ability to grow. So what's the difference between guilt and shame? So guilt is a feeling of remorse that we experience regarding a specific situation or specific action that we have done and that we can make amends for. And guilt is actually a motivating emotion, so it's actually healthy for you. It actually helps you move forward. And like I said, it's limited to specific situations. Shame, on the other hand, it's not just about viewing your actions as wrong, but seeing yourself, your whole identity, as somehow wrong, defective, inherently damaged. And that unfortunately comes a lot from difficult upbringing experiences, and especially often when people experience trauma. So why is it so frequent for people who had trauma to experience shame? Well, there is a very easy explanation for that. We are all born with this view of the world as safe and predictable and logical. We are all born with this just world hypothesis, and it's indoctrinated into us by our parents, teachers, religion, and it goes like this. Good things happen to good people, bad things happen to bad people. And if you think about it, it's the reason parents and teachers use it is because if they told you, if you do this, you might or might not get punished, it's highly unlikely that you will listen. But if they tell you, if you do this, you will get punished, then that works. So a lot of us buy into this. In reality, our world is much more unpredictable and random. We all know that good things happen to bad people and bad things happen to good people. However, to let go of that view is kind of let go of our sense of control, of feeling like we got it. If only I do certain things, I'll be okay. Well, it doesn't work like that. And to accept that the world is inherently unpredictable and random, it's scary. So a lot of us actually adapt and kind of change the view the view of what happened, the traumatic experience, so that we can still preserve this view of the world as a safe place that makes sense. So if we've experienced trauma or anything else that doesn't fit in to this view of the world and this logic of good things happen to good people, bad things happen to bad people, we actually change the way we see the event to fit this belief. And so it becomes, this happened to me, so I must be bad. There's something about me that must be bad that caused this. And once you develop this belief, it stays with you and it causes constant feelings of shame. And here's the thing, shame, like I said, it's a much broader feeling. It's about viewing yourself as inherently wrong, and it's defined as feeling of humiliation and disgrace, leading to a loss of respect and esteem for oneself. So, whereas guilt leads us to want to change and do better, shame only leads us to want to self-sabotage, want to run and disappear. It cuts off our attempts to bond with other people because we have this fear that, you know, if others only see what we really are like when they get close to us, they will know what a piece of shit I am. They'll know what fraud I am. How many of you have these beliefs? I did. So, as you can see, shame is very detrimental, and it's very detrimental to our recovery because this intense feelings of humiliation and wanting to disappear, they lead to us wanting to use substances to get rid of this experience, to help us feel like we disappeared, to not experience anything. So shame kind of reinforces the addiction, and it's a vicious cycle. So what do we do about this? Especially since research shows that people struggling with addiction who experienced guilt actually tended to relapse much less, and as opposed to people who reported feelings of shame, they tended to relapse more often, harder, and use harder drugs, which makes a lot of sense. Feelings of shame will stop you from attending self-help meetings because it leads to desire to isolate, hide, lash out. So what I want to say here is because shame is such a powerful feeling, it's very important to get a grip of it before you can achieve lasting recovery. And I'm gonna talk about a few steps you can take right now to start to transform your shame into feelings of guilt that will actually be helpful to you. First, we need to learn the difference, differentiate between feelings of guilt and shame. And I kind of already gave you a lot of hints here. First, guilt is feeling bad about a certain behavior, circumstances, situation, and usually doesn't affect our view of ourselves as inherently wrong. Shame is a much broader feeling. It goes straight to our identity. It makes us feel like we are a bad person, that we don't deserve any good things. So it's a much more deeply ingrained belief about yourself, rather than an emotion that can be dealt with by changing your actions, like guilt. And you can easily detect shame in your body. These are pretty intense sensations. Usually, people say they feel emptiness in the pit of their stomach, narrowing of the chest, a slumped posture, avoiding eye contact with others, burning in the face, and feelings of wanting to disappear. With shame, there is no motivation to mend or resolve anything, just an overwhelming humiliation and desire to run. So, if you've detected that you are feeling shame, here are the few steps that can help you on your way out of it. First of all, remind yourself that making a bad choice does not mean you're a bad person. And focus your attention on the specific actions and take responsibility for them and admit where you were wrong. And sometimes you have to let yourself feel the pain of harming other people and grieve that and feel the sadness. In other words, don't berate yourself, berate the actions that you made. Number 2, be kind to yourself. And here we can draw on books and studies on loving kindness and self-compassion. It can do wonders for you, because you all know we are our worst critics. We can be so nice to other people and yet really treat ourselves harshly. And a little trick that you can use is talk to yourself the same way you would talk to a friend, a very good friend, a child, or if you're an animal person, to an animal. So what would you say to a child or friend who was feeling terrible about themselves? You would probably say something like, don't worry, we all make mistakes. Just shows that you're human. It's okay, you can fix it. So see how different it is from saying that, that just proves you're a terrible person, a piece of shit, and that's what you deserve. So please watch your language and give yourself some of that kindness that you give others. Number 3, learn to recognize that substance use or other compulsive behaviors developed in the beginning as a way to help you cope with otherwise unmanageable emotions. Not all of us were fortunate to be born in a family where our parents modeled healthy coping skills. So most often when something big happens, we don't have the tools to deal with it. And the only way to cope with that immediate feeling of being overwhelmed is to use substances to suppress it. So in the beginning, it is begins as an adaptive mechanism because it helps you fight that need to isolate and fear of intimacy. That's a huge one when it comes to shame, especially in individuals who are traumatized. They are terrified of intimacy because intimacy makes them vulnerable and feel exposed, and that fear that others will finally see me who I really am. So it's important to first note that at some point your harmful coping skills had an adaptive purpose, and at some point they stopped serving you, but they're very difficult to manage. And seeing substance use or compulsive behavior as a coping mechanism, we can start to release some of our shame and begin to learn other ways to cope. It is important to approach your relationship with substance use and compulsive behavior in a curious way, compassionate way. And keep in mind that setbacks and slip-ups are part of recovery. In fact, several recent studies shows that it takes an individual on average 13 rehab stays before they finally get it right. I know it sounds alarming, but then there's hope there that eventually they get it right. And so compare yourselves. Are you an average person? Thing is, addiction, eating disorders, they're very, very hard to manage. One of the most difficult to treat disorders. So if you fail, just look at the statistics and try again. And consider each relapse as an opportunity to learn more about yourself and about what works for you to stay clean and sober. What works and what was missing in your original discharge plan or relapse prevention plan. Ask yourself, what prevented me from having a successful recovery at that time? And maybe it was the fact that you got everything covered, but you never developed this strong social support network. Or maybe you have a tendency to isolate, and in the end that's what got you. So when you go to your next rehab program, think about focusing on those specific things that were missing in your previous program, and just work on those. Put all your effort into working on those and creating a different plan where you will be surrounded by healthy supports. Finally, I encourage you to seek psychotherapy. I know this might be the last thing that you want to do, especially if you're prone to shame. It may be so difficult to open up in front of another person because we expect to be judged, and we think that others will think we're disgusting and just depraved, and they will be disappointed if they really know who we are. Trust me, that's a very common experience, and it's a very false experience. Basically, all the patients I work with, and even when I entered therapy, those were my feelings. And the therapist is there to provide you with a feeling of unconditional positive regard and acceptance. Trust me, they have heard it all. And we as therapists, we go into this field because we believe in the basic human goodness. And we believe that there's something good in everybody. And it's just a matter of helping them tap into it. So please don't hold anything back from your therapist. That's just gonna take longer to work. So there are several specific treatments for traumatic experiences, such as cognitive processing therapy for PTSD. Then there is EDMR. Then you can also use cognitive behavioral therapy. They all help to focus on those thoughts, the faulty thoughts that you developed about yourself, that you keep repeating to yourself, even unconsciously, automatically. And this therapist will help you challenge them and see that they're untrue. There's also internally family systems therapy for trauma. That's a whole other topic I want to talk to you about, because I'm going to be getting a training in it soon, and I think it's just a very fascinating model. It's very different. But in general, any type of therapy where you feel that the other person cares and accepts you the way you are is gonna help. And until you find a therapist that you can trust, I wanted to give you some resources to start. Well, one thing I wanted to mention is, if you're already shame prone, some of the 12-step meetings, especially those that are kind of led by people who were trained in the 70s, a lot of them are very confrontational and shaming. So I would avoid those types, because they will just reinforce your shame and ensure that you never come back. I would then there are a lot of other good ANA 12-step meetings that are actually very accepting and compassionate. So just experiment, go to different ones, see which ones work for you. Then there are other resources such as Life Ring Recovery and Smart Recovery. Then I also want you to consider a harm reduction model. It's actually the most well-researched, the most current view of the best treatment for addictive behaviors. The idea is that it gradually decreases your use of substances or addictive behaviors, and it does not have that same shameful view of relapses. So you're not expected to go cold turkey and stay abstinent. And research shows that this model works best. So you can try that out as well. Now, I'm going to be mentioning several of my favorite books that deal with shame, and one of them is the Radical Acceptance, and the other one is the Radical Self-Compassion. And also I will put some websites that train in self-compassion and things like that. And I'm going to be posting a link to my original article on guilt and shame. And in the meantime, I hope you stay healthy and safe. Love you. I'll see you soon.